Postpartum insurance challenges. The U.S. is the only developed country where the maternal mortality rate has been steadily rising. The U.S. maternal mortality rate jumped from 7.2 deaths per 100,000 live births in 1987 to 16.9 deaths per 100,000 live births in 2016. Black women and American Indian Alaska Native women are 3.3 and 2.5 times more likely, respectively, to die from pregnancy-related causes than non-Hispanic white women. A majority of the pregnancy-related deaths are preventable and often stem from lack of coverage and access to care in the critical time following birth or from changes in coverage that can disrupt continuity of care. Approximately 60% of pregnancy-related deaths reviewed by state maternal mortality review committees from 2011 to 2015 were preventable, regardless of race. For every woman who dies from pregnancy-related causes, significantly more suffer from severe maternal morbidity. In 2014, more than 50,000 women in the U.S. experienced severe maternal morbidity that resulted in significant short or long-term consequences to their health. Severe maternal morbidity disproportionately impacts women of color. For example, Black college-educated mothers who gave birth in New York City from 2008 to 2012 were more likely to suffer severe complications from pregnancy or childbirth than white women who never graduated from high school. Pregnancy-related deaths occur well beyond the 60-day postpartum period. Nationwide, approximately 29% of pregnancy-related deaths, not including those caused by accidents, homicides, and suicides, occur 43 to 365 days postpartum. Some states' analyses of pregnancy-related deaths, which include behavioral health-related causes, find that 50% or more deaths occur beyond the 60-day period. For example, in Illinois, 51% of all maternal deaths occurred more than 60 days postpartum between 2014 and 2016. In Texas, between 2012 and 2015, 56% of all maternal deaths occurred more than 60 days postpartum. And in West Virginia, the rate of maternal deaths occurring more than 60 days postpartum was 62% from 2007 to 2013. Nearly half of all U.S. births are financed by Medicaid, and in some states, the rate is much higher. The maternal health crisis is not limited to Medicaid-enrolled women, but Medicaid-enrolled pregnant women are more likely than women enrolled in private coverage to have had a preterm birth, to have had a low birth weight baby, and to experience certain chronic conditions, putting them at higher risk for poor maternal outcomes. More than half of women from 2005 to 2014 with at least one chronic condition at delivery were covered by Medicaid. Compared to women with private insurance at delivery, those covered by Medicaid are more likely to be Black. There is broad agreement that women with a Medicaid-covered birth should receive 12 months of postpartum coverage. Since Congress established the 60-day postpartum period for Medicaid coverage for pregnant women in 1986, much more is known about maternal deaths and the delivery of postpartum care. Notably, the CDC now defines the postpartum period to be 12 months after delivery. State maternal and mortality review committees, as well as the American Medical Association, the American College of Obstetricians and Gynecologists, the American Academy of Family Physicians, the Society for Maternal-Fetal Medicine, numerous health plans and consumer advocacy groups recommend that policymakers extend Medicaid coverage from the current standard of 60 days to 12 months postpartum. So what are the key reasons why states' pregnancy coverage should be extended beyond 60 days postpartum? Expanding postpartum insurance coverage to beyond 60 days postpartum ensures and simplifies postpartum coverage. Extending postpartum coverage in Medicaid provides an automatic 12-month coverage pathway during a very vulnerable time, providing coverage for women without other options, mitigating barriers to other coverage pathways, and preventing disruptions in care. Extending Medicaid coverage is the surest, simplest, and most targeted way to address loss of insurance or gaps in coverage among postpartum women. No new eligibility category, application, or redetermination is required, and cost-related barriers to coverage and care are eliminated. The 12-month postpartum period would allow a new mother to stay on coverage automatically, just as she does now for 60 days. Neither the new mother nor the state Medicaid agency would have to take any action for coverage and care to continue uninterrupted. The expansion of pregnancy coverage beyond 6 days postpartum also improves continuity of care and care coordination. By extending the Medicaid postpartum coverage period to 12 months, new mothers do not have to switch from providers they trust that understand their health history and may be treating their chronic conditions during a vulnerable time. Providers can also better coordinate care over a 12-month period versus 60 days. Lapses in insurance coverage and related systems of care issues have been credited as one of many contributing factors to the nation's growing maternal mortality crisis. Poor continuity of care and/or lack of care coordination were identified as factors that contributed to death in 93% of preventable pregnancy-related deaths in Illinois during the late postpartum period, which is 61 to 364 days postpartum. This slide shows factors that women worry about the most during the postpartum period. With extended insurance coverage past 60 days postpartum, many of these would be eliminated, such as insurance. Women would be treated for their postpartum depression. They would have their questions answered for newborn care, and they would also have social support and support for breastfeeding. The expanded postpartum insurance coverage also aligns continuous coverage for both mother and baby for 12 months postpartum, regardless of changes in family income. Under federal law, babies born to mothers with Medicaid coverage at the time of birth receive automatic and continuous Medicaid eligibility for their first year of life. Extending the Medicaid postpartum coverage period for 12 months ensures continuous coverage for both mother and baby, improving care coordination for the mother-baby dyad and creating administrative efficiencies for the states at redetermination. The point of the postpartum coverage extension policy is to reverse the trends in maternal health and improve maternal health outcomes. It is well documented that access to health insurance increases access to and use of healthcare services and improves health outcomes. For example, Medicaid expansion is associated with 7.01 fewer maternal deaths per 100,000 women relative to non-expansion. Improving access to Medicaid has also been associated with increased use of postpartum outpatient care, particularly for women with severe maternal morbidity. Extending the Medicaid postpartum coverage period to 12 months would increase access to and use of healthcare services and improve maternal health outcomes. Continuing insurance coverage for postpartum mothers will also improve health outcomes for children, because children's healthy development is dependent on the health of parents. Maternal depression negatively impacts young children's cognitive and social-emotional development and future educational and employment opportunities. Extending health coverage to adults results in increased health coverage for children. Most uninsured children are eligible but not enrolled in Medicaid or the Children's Health Insurance Program. Their enrollment increases as their parents get covered. Parental enrollment in Medicaid is associated with a 29 percentage point higher probability that a child will receive an annual well-child visit. The extension of postpartum coverage also will save billions of dollars in annual severe maternal morbidity costs. The average total per patient costs in 2013 for Medicaid-enrolled pregnant women with severe maternal morbidity was $10,134, compared to $6,894 for women without severe maternal morbidity. In 2011, Medi-Cal paid more than $210 million to treat maternal hemorrhage and hypertensive disorders. Perinatal mood and anxiety disorders, which are the number one complication of pregnancy and childbirth, affect at least 1 in 7 women, yet only half of perinatal women with depressive symptoms receive any treatment. Examining perinatal mood and anxiety disorders alone, the national economic costs of not treating these disorders amounted to $14.2 billion in 2017. Given the maternal health crisis across the U.S., states face an imperative to act. With nearly half of all U.S. births covered by Medicaid, states have an opportunity and a responsibility to improve maternal health and address disparities in health outcomes. Extending the Medicaid postpartum coverage period from the current 60 days to a full 12 months is the simplest and most targeted way to address coverage loss and continuity of care for postpartum women. While a Medicaid postpartum coverage extension will not single-handedly solve the maternal health crisis, it is foundational to most other efforts because it provides vital coverage and continuity of care to postpartum women during an extremely vulnerable time.